we will be discussing a topic on Whipple's disease. Whipple's disease is primarily it is a systemic disease which is chronic and caused by bacteria and is an infectious state. The name of the bacteria is Myorthymia whipplei. It is derived from a Greek word which means trophy means nourishment, and erema means barrier. So nourishment barrier. Exactly the pathophysiology behind the Whipple's disease is that there is a malabsorption syndrome with some of the systemic features. So in order to facilitate the meaning of the disease, it has been significantly called as Myorthymia, derived from the Greek word, and this has been first identified and addressed by the scientist George Whippley, hence the name Myorthymia whipplei. So Whipple's disease primarily it is thought to be of affecting the gastrointestinal tract, but it can affect any organ starting from your eyes to your toes. So it is a systemic disease. So moving on to the morphological features, it is a gram-positive bacteria. It is thought to belong to Actinomycete family, since it has group B peptidoglycan. 16S RNA, ribosome RNA. So the most common affected site or the most common affected organ is your small intestine. In specific, where in the small intestine it is located most commonly in the lamina propria. It is an extracellular space located between the epithelium and next adjacent to your basement membrane. And characteristic features of this lamina propria is foamy macrophages that are seen in the lamina propria. Foamy macrophages. These are stained by a special stain called as spas stain, which stains positive, hence it is called as spas positive. It is spas stain was first applied by Black Scoffer. Important to remember it because, as I told earlier, it is a systemic disease. It can mimic an n number of diseases. It is a great mimicker. This important feature from the small intestine biopsy, that is foamy macrophages in the lamina propria, which stains spas positive and diastase resistant, that is negative for diastase, is an important feature you have to remember, because in the same feature, if you see in your kidney for amyloid, is again spas positive plus Congo red positivity is seen. The role of is also involved in the pathogenesis of Whipple's disease. It was first identified by Dr. George. This was first identified by Whipple, who was a pathologist who first did the autopsy and found out that in the autopsy there was lipid deposits in the mesenteric biopsy he did, and there was a lipid deposits plus foamy macrophages. These foamy macrophages is also seen in lymph nodes. These lymph nodes can be of abdominal lymph nodes such as mesenteric lymph nodes, or it can be seen in mediastinal lymph nodes, or it can go to peripheral lymph nodes such as your axilla, inguinal group of lymph nodes. It can be seen in joints, which leads to arthralgia, or it can be seen in your heart, can lead to endocarditis. Valvular lesions can also occur, and in your eyes it can cause uveitis, and it can persist in your central nervous system, and to be very specific, it can also occur as an isolated disease, although rare, of affecting the central nervous system. So moving on to the symptoms, what you must understand is that you can present with a wide range of symptoms such as malabsorption syndromes, much alike like malabsorption syndrome, such as weight loss. These are under GIT symptoms: weight loss, diarrhea, abdominal pain, colic pain, cramps, etc. What's interesting or important about this is, even before the onset of the GIT symptoms, arthralgia precedes the GIT symptom. That is, it is the earliest, one of the earliest lesions to occur. So important to note that even before the symptoms of GIT, arthralgia, patient may present with arthralgia, and this arthralgia might be of migratory and intermittent nature. Migratory and intermittent. And then there can be a generalized symptoms such as fever, malaise related to any bacterial infections. And as I told previously, there is a role of immune important in the pathogenesis of Whipple's disease, is that it is related to HLA B27 and interferon refractory factor 4. Interferon refractory factor 4. And most important to note that Th1 helper 1 cells are decreased and Th2 response is very much higher in case of Whipple's disease. Moving on to the next symptoms, that is your CNS. It is very important as although there are, it can occur as an isolated organ disease. Most common symptom of Whipple's disease in the CNS is dementia. But most pathognomic is oculomastigatory myorrhythmia. I will show you the video so that you can understand, but you must remember the term oculomastigatory myorrhythmia or oculofacial skeletal myorrhythmia. If this is there, then 100% you can diagnose it as a Whipple's disease, because it has not been reported in any other disease. So it is a pathognomic feature of Whipple's disease. Apart from this, it can cause supranuclear ophthalmoplegia, ataxia, nystagmus, etc. So this is a video showing the oculomastigatory myorrhythmia. You can see the patient when starts moving his mandible or chewing, mastigatory movements, it coincides with your ocular movements also. Ocular, it's like ocular bobbing. Okay, I will show you it again. See the patient starts chewing, can very well appreciate the ocular movements also. This is called as oculomastigatory myorrhythmia.